Good afternoon.
Good afternoon.
Thank you for coming. My name is Magda Rodriguez. I'm the Director of Financial Counseling, and I'm going to talk to you this afternoon about what financial counseling can do for you, the different programs that are offered through UMass Memorial Medical Center in terms of finances and financial counseling, okay? So how can financial counseling help you? So there's a bunch of different ways that we can help our community with insurance questions, balances, more like it, particularly questions regards to mass health, okay? And so I'm going to explain to you the role of the financial counselor. We're going to review different programs that are available through our team, and then we're going to identify the basic coverage requirements for those who are looking to become eligible or see if they're eligible for mass health. We're going to review the various types of mass health coverages that exist. Mass health is not just one. They have lots of different programs depending on different criteria. We're also going to review required documents for the application process, and then we're going to share the different locations where financial counseling is available to you. All right? Any questions before we get started? No? All right. Can I just get your name so I know who's here?
Dino.
Dino?
Julie.
Julie?
Julie.
Julie, okay. Did I get it right?
J-U-D-Y.
Judy, okay. Dino and Judy?
Sarah.
And Sarah. Nice to meet you all. Again, my name is Magda. If you come across any questions in the middle of this, just stop me, okay? I won't make you wait till the end to ask questions, all right? I find it better if we're just kind of interactively going through this. I do have in the back, Jenny and Nilka. They're two of the supervisors on my team. Nilka is a supervisor for the Harrington campuses as well as the other community hospitals, which include Marlboro and Health Alliance campuses. Jenny oversees the Memorial campus and the University campus out in Worcester. And Elena, who is not here, oversees, actually, you oversee Hanneman and University. Memorial is overseen by Elena. Okay, and she also oversees our follow-up team. Okay, can I just get one of those as well? Thanks, Jenny. I have to admit, these days, I don't hold much up in this head of mine. There's just so many different things, so I'll need my little cheat sheet here. All right, so what do you think a financial counselor is? Or who is a financial counselor? What's the role of a financial counselor? Okay, and if we're not sure, we'll give you some answers here for that, okay? We're, of course, hospital employees. We're not employed by the state. We're employed by UMass. Okay, and we assist patients primarily with applying for mass health, any of the mass health products. In addition to mass health, we also help patients apply for Health Connector, which is one of the Affordable Care Act plans here in the state of Massachusetts, and also for our own UMass Memorial Financial Assistance Program, which is a program that we as an organization provide to the community in addition to other things, okay? Our financial counselors all must become certified through the state in order to provide these services. And so they go through a in-depth training in regards to the different regulations and rules and, eligibility criteria. What are the exceptions? What are the rules? And so they go through quite a bit of training in order to become certified. That training is ongoing. Every year they must be recertified and so forth. They also help facilitate the application process. Many a times, patient just gets a mass health booklet. Have you seen the mass health booklet? I'm going to ask Jenny to go ahead and hand out the mass health booklet so you can have one, just as a point of reference, okay? The mass health booklets are nice. They're glossy on the cover, okay? Lots of pages. On the very front of it, the application's in the center pages of it, but the pages in the beginning and at the very far end of the booklet are more of information in terms of the different plans that Mass Health provides, as well as the different criteria and eligibility and what determines you to be eligible for one program versus another, okay? So we also help explain the different programs more in depth and also on how to determine what specifically you may be eligible for. And of course, there's, with life, things are constantly changing, right? You're employed, now you're out because you're sick, you'll be returning back to your employment, but for a while you'll be out of work. Those are things that can help us determine some form of eligibility for a short period. Or you become 65, you have certain health conditions or new health diagnoses. Those things are also considered when we're doing an application with a patient, okay? And then in addition to that, we will also take that extra step to help notify the state that a patient may have some food insecurity, which means we'll also help them connect with the state in terms of becoming eligible for SNAP assistance or supplemental nutrition, okay? Now, what assistance specifically is available here at UMass? Of course, doing the Mass Health applications, doing the MADA, which stands for the Massachusetts Disability Applications.
Mental adult disability.
Okay. Medical hardship, right? You may be over income for Mass Health itself, but you do fall within a certain guideline. You're claiming a certain hardship to the state. We can bill balances to the state to see if they would accept those charges. Also, Health Connector, if you're over a certain income, you're not eligible for a state Medicaid program, you may be eligible, as I mentioned earlier, for an affordable health care plan. Okay, and then of course, as I mentioned, our own hospital financial assistance when all else fails. Okay, we have no requirement of who can apply for the financial assistance. There is an income requirement, however, your income must be below 600% of the federal poverty level, which is quite high when you consider what the federal poverty level is. So we are a bit generous when it comes to our financial assistance plan. And we do offer that across the board to all of our patients, irregardless of whether they have insurance or not. Any questions?
It's good as far as determining the person's income.
Mm-hmm.
If you have an investment account that you built yourself over the years and you take a monthly withdrawal from that, is that considered income?
So is it a Roth or is it not a Roth? And there's a bunch of other little things that will come into play as to whether it's considered income or not. It all depends on how it comes out at the end with your taxable income at the end, right? And so there is certain guidelines. If you're over the age of 65, they look at things a little differently, okay? They do look at any securities you may have saved up, they'll look at pension, they'll look at retirement accounts that you may have. So Mass Health will look at that as well when they're doing the Mass Health application. When we're doing our financial assistance application, we have a little more leniency on that. And correct me if I'm wrong, Jenny, okay? All right, thank you. But yes, there's certain securities you may have that they will look at. For Mass Health, straight off the board though, you cannot have more than $2,000 in a bank account. Okay, so that's the first thing. And so if you're like, okay, well I am over that amount, you may cross that box out, but you may still be eligible for other things. Okay, so I want to just emphasize that. If you're not eligible for one form of assistance or Mass Health product, you may be eligible for something else. Okay? All right. So let's talk a little bit about Mass Health, right? For Mass Health, as I mentioned, that's a Medicaid program. Every state has their own Medicaid program. It's funded by the federal government and through the state governments as well. And here in Massachusetts is called Mass Health. The other states may have a different name. If not, they just call it straight Medicaid. And biggest component to it is you must reside in the state of Massachusetts, okay? They also look at different things in regards to your immigration status. Are you a naturalized citizen or are you a born citizen or naturalized citizen? And, or are you still on a pending status, your visa, okay? Have you been in the US more than 5 years if you have immigrated into the United States, or are you here less than 5 years? All those things are gonna factor into the type of eligibility you may have for Mass Health. And then of course, finances. They look at your modified adjusted income, your MAGI. And you'll see that repeatedly in the documents and so forth. Mass Health uses that a lot, but it's the modified adjusted income that Mass Health and Health Connector will use to determine things. Now, Health Connector, of course, is only eligible to individuals who do not have Medicare, okay? Because of course it's a commercial health plan that you're purchasing at a reduced rate through the Affordable Care Act. But Mass Health may be able to offer you something different, like a senior buy-in. If you are below a certain income, they might help you with your premiums for your Medicare or different things. Now, if you're under the age of 65, for Mass Health, right, we're basically looking at parents that are living with children under the age of 19. So if you have a child, an adult child who's 18 years old and lives with you, they're still counted as part of your household, all right? An adult caretaker that is living with, it doesn't have to be a parent, with any child under the age of 19, whether it's through blood, adoption, or marriage. Spouse, former spouse. If you're younger than the age of 19, let's say you are a emancipated minor, you're considered your own household, okay, through Mass Health. Any young adults between 18 or 20 years of age would be eligible for these plans. Adults 21 through 64, of course, are eligible to apply for the Mass Health. There's different forms for Mass Health. And so if you're under the age of 65, you're just doing what's called an ACA application, which is the, ACA stands for application. I know ACA is for under 65. I forgot what the acronym, I apologize for that. SACA, senior application, is the one for the seniors, okay, for 65 or older. If you are pregnant, disabled, or HIV positive, or a breast or cervical cancer patient, you may be given allowances for slightly higher income levels if you do have any of those diagnoses at the bottom, okay? And this is where it all comes down to in terms of the numbers. So like I mentioned, right, Mass Health looks at the Madga, the adjusted gross income, the modified adjusted gross income. And so you can see here a family, and this mouse isn't working so well. You can't see it on the screen. But anyways, if you look up here, family size, right, monthly for the Mass Health standard, that's kind of like the gold card of Mass Health, covers everything and anything, okay? You have to have a yearly income less than $6,264. And you may ask yourself, well, who's gonna qualify? Believe it or not, there are a large number of individuals who do qualify in that range. Usually you're seeing households of 2 or 3 or 4 falling within that criteria, but there is a lot of families who are struggling financially and fall within the limits of the Mass Health standard. And so the federal poverty levels throughout the US, you'll see it here in the second column, okay? And so that will still mean that you may qualify for some additional Mass Health products, maybe not Mass Health standard, but maybe like a Mass Health Care Plus, okay? And as you start going up the different percentages, now we're start looking to see if you're eligible for a Health Connector plan. So individuals who have that slightly higher income and are not eligible for a Medicaid funded program, they would be eligible for purchasing commercial insurance at a reduced rate. Children, however, would still be given the Mass Health product for the children, but the adults would have to purchase their insurance through the state, okay? Now, Mass Health coverage types. So as I mentioned, right, standard is kind of like the gold card, that's the everything. We then have, so standard provides the full range. Common health is another type of Mass Health coverage that's available. They all get the same blue card that says Mass Health on it. There's nothing to distinguish from one card to the next what coverage one has. We typically run eligibility through our system to determine what type of Mass Health coverage you have or what level of coverage you have. Common health is healthcare for certain disabled individuals or disabled children who don't qualify for standard. Care Plus, again, offers a broad range of healthcare benefits, very similar to Mass Health Standard, but to adults who are not otherwise eligible for Mass Health Standard. Again, there's a slight tweak in that income range where you would then be eligible for Care Plus. Family assistance is another form of Mass Health coverage that's available. Again, Mass Health residents, everybody has to be a Mass Health resident to qualify for any of these plans. Okay, but again, changes in the income level, family size, etc., or immigration status, okay? Premium assistance, okay? If you have access to other health insurance, Mass Health may help pay for your insurance premiums, okay? You won't have Mass Health coverage where they won't pay for your bills per se, but they will help reimburse you your cost of insurance. And then Mass Health Limited. Mass Health Limited is developed to help our immigrants in our community who need access to emergency care. It does not provide them with regular medical care, prescriptions, okay, doctor visits. They would have to go to a community health center in order to receive those visits through another program, but Limited is still something that is made available to individuals, particularly if they've been in the U.S. less than 5 years, okay, and need access to emergency care. Now, if you're over the age of 65, Mass Health has their own products as well. They look at things a little differently for you. They also look if you need a PCA, a personal care attendant. And so, interestingly enough, this previous week we had a patient who was on a more limited type of Mass Health coverage. And due to illness and so forth, there was change in his needs. He now needed a personal care attendant, a PCA. And so when we submitted the application for the PCA, Mass Health deemed that he is now eligible for Mass Health Standard in addition to coverage or payment for a PCA. So Mass Health looks at things differently. So if something changes, see a financial counselor will help you through that application process. We'll submit it and see if there's something more that you can now be eligible for, right? How can we expand the services you're currently receiving from Mass Health? Okay. 65 years older, disabled, either working, you can be working and still be eligible for Mass Health, right? Either working 40 or more hours a month, they're currently working, have worked at least 240 hours in 6 months before the application. So we'll look at all these things. If you're not working, obviously, if you're living at home and you do not need long-term care, right? That's where a PCA comes in. They're trying to keep you from going to a skilled nursing facility, right? We know the cost of nursing homes is very expensive, so they try to keep a patient at home. Outcomes are usually better when the patient can remain at home. So that's another reason that they would look at this and determine, right, what they may be eligible for. And again, income will vary once we start looking at these things. All right. So living at home and you need long-term services and support under home and community-based services, or if things have really become more difficult and challenging and you do need to be placed in a long-term care facility, a nursing home, then we can also help and assist with that application process. It's a more in-depth process. Typically, we will do long-term care applications when a patient is admitted in the hospital and the decision has been made. This patient now needs to go from hospital to long-term facility as opposed to being able to return home. We will help with the application process at that point in time to help get them the coverage that they need for the nursing home. Okay, so here we have some figures again, how they look at the different incomes. There's a table to determine eligibility for Mass Health if you're over the age of 65. Okay, and so living arrangements category, if you're living by yourself, if you're individual, not married, okay, or separated, this is the asset limits that they will look at. Like I said, you can't have more than $2,000 in your bank account, okay? And your Medicare premiums are listed as they are here. We've seen that the Medicare premiums have also gone up. That's something else that Mass Health will do. Mass Health will help pay Medicare premiums if and when necessary. Okay? If you are a married couple, okay, the asset limits do change a little bit. They give you a little more room. Of course, you're looking at 2 people versus 1 person alone. And then these are the types of coverages that are available to seniors and individuals who are over 65. Very much the same as we saw for under 65. You've got your Mass Health Standard, your Commonwealth Care for your disabled, your senior buy-in. That's the one where I mentioned that they will help pay for your Medicare Part A, B premiums, okay? And they may also help cover your Medicare co-payments and deductibles as well. Family assistance is available. And of course, the buy-in and Mass Health Limited, again, if you are not receiving Medicare benefits, not been in the States for more than 5 years, and have an immigration status. Health Connector, I mentioned a few times. Okay, this is the plan. It's the health insurances marketplace. Under this, there's different plans available, like you will have your Aetna, you will have your Blue Cross, you will have your Tufts, you will have your Fallon plans available that you can select from and pay a premium for. Generally, this is not for individuals who have Medicare. Okay, this is for the population under 65. If you're over 65 and are not eligible for Medicare, there's some people who are not eligible for Medicare because they haven't been in the US long, then they would be able to purchase a Health Connector plan. You just cannot have a government plan and a Health Connector plan. So in other words, you can't have Health Connector and Mass Health, you can't have Health Connector and Medicare. Financial assistance. So this is where, as a hospital, we provide you with additional financial assistance when all else fails, when you're not eligible for any other product, okay? Or you may be eligible for some form of for Mass Health product, but you've got older balance that are not eligible. We do our financial assistance review, and there's different things that we can identify where we can help you with some additional discounts. So we'll do a comprehensive review of the finances. We'll help the patient through the process. Okay, to be eligible for our program, you must be under 600% of the federal poverty level or up to 600% of the FPL. You have to complete a financial assistance form, and that is available on our website. Or you can be requested by calling our team. We would require that you provide income verification, information on any additional household members, okay? We see a lot of individuals who are over 65 and are now what? They've raised their children, now they're raising their grandchildren or their great-grandchildren. And so they would have special limits to be able to include them in their accountable household members. Okay, we would require that they apply for Mass Health if their income is below a certain level as well. And we'll begin the application process from the date of the first bill and statement. So financial assistance eligibility begins the date that the application is completed and is received by our team. And eligibility for financial assistance discounts, because basically that's what we're doing. We're giving you a discount on any balances that you have. Those discounts will be approved a year forward from the date of the application submission, and then a year retroactively from the application. So if there's older balances, we can help with that as well. Okay. They have been approved for the UMass. Discounts have been approved. They will apply to urgent, emergency, any medically necessary care like observation, if you're in the hospital as observation, not admitted as an inpatient, but still kept under supervision. And then for any outpatient services as well at the hospital. And then things that are not medically necessary, okay, cosmetics, okay, infertility services, things like that, those would not be covered under our program. And this is our guidelines for financial assistance. And as I said, right, we saw where the FPL was 100%, we're going way over that. And if you're a Massachusetts resident, and you're under 300%, you must apply for Mass Health first, okay? Copays are not discounted under our financial assistance program. And if it's for hospital charges, you would only be responsible for 30% of the charges. We'll adjust the rest, yes.
What is the federal poverty level?
The federal poverty level, so if you go back to page, slide number 7. So the federal poverty level is at 100%. So as I mentioned, for a household of one, it's $15,060 a year.
So $15,000 a year.
Yes, okay. But then when they do the math and they do the modified adjusted gross income, there's certain deductions and things like that. That's the percentage that we need to look at to kind of really determine where someone's going to land on the scale of everything, okay? So the hospital does a 70% discount, which means the patient pays 30%. But then for the physician services, okay, they have a sliding scale. So you can get up to 100% discount, if not as much as a 35% discount off of the total, off of your charges or balances, okay? Now, what to bring when you're coming in to visit a financial counselor, trying to do, let's say, a long-term care application or a mass health application, for a standard or something, right? Always social security number for every household member that lives with you. Any income information that you have, pay stubs, social security benefits. If you file taxes, you need to bring your tax return as well. Information about your citizenship or immigration status if you are not naturalized or a U.S. citizen. And then any information about any job-related health insurance you may have, okay? Now, we talked about Mass Health. Now we're talking about the disability supplement that is available. That's another program offered through Mass Health. And basically, disability standards require that the disability has lasted or is expected to last more than 12 months, okay? Otherwise, it would be more of a short-term, long-term disability through work. Typically, that's how it happens. To get Mass Health based on your disability, you do need to tell us several things, right? Who your medical and mental health providers are, and then your work history for the past 15 years will need to be disclosed as well, as your educational background and what your daily activities are. They want to determine what you were pre-disability, what you are now that you're facing a disability, okay? And then the UMass Disability Evaluation Services will ask for your medical and treatment records from your providers in order for them to make that determination. All we do as financial counselors is help facilitate the process. Collecting the documents, faxing them, submitting them, emailing them, whatever the case is, uploading documents, giving you back your originals so that they have what they need, okay? It's not an application for medical benefits, again. It is just an application for disability assistance if you are now disabled. Medical hardship. It's another type of assistance that's offered where through the fund that's called Health Safety Net, and it's a fund throughout the state. I've not seen it in the other states that I've worked at. It's more here in Massachusetts where different healthcare providers, insurances, and so forth contribute after a certain amount of payments into this fund. This fund is used to help individuals who are having medical hardships, okay? And so what that allows us to do is if we can show that income criteria, et cetera, we're able to submit your balances to the state and then through the Health Safety Net Fund, hopefully have them approved and paid for. So that's another way to kind of help patients through healthcare is hard enough, right? Especially when you're dealing with new diagnoses or new conditions or progressing conditions, right? To have to deal with the finances behind it can be extremely overwhelming. So there's different things available that will help you through that process, okay? And then you'll see here, Health Safety Net will not finalize processing of the medical hardship application for patients with incomes below 405% until the patient has documented an eligibility determination from Mass Health and other programs. So when it says 405%, okay, and that you have to have documented eligibility, it means, remember, Mass Health may offer you some other services, other coverages, okay? You will just be required to apply before medical hardship paid through Health Safety Net kicks in. And then information about the documentation that's needed, okay? So when we're submitting a medical hardship application, it's not as in-depth as the Mass Health application as you have in your booklets, okay? But they're asking for the same information in terms of demographic, household income, what are your medical expenses? When you do your Mass Health application, they don't ask about your medical expenses. Medical hardship, you have to demonstrate that you're facing a financial hardship, and submitting your medical expenses is one way to do that, okay? Proof of Massachusetts residency, of course, is only eligible for those who live here in the state of Massachusetts. And then, of course, detailed itemized documents for all applicable medical expenses. So you can tell me you have got medical expenses, we need to have statements behind that to show what those balances are. We'll need to submit that to Mass Health, or not Mass Health, but to Health Safety Net, okay, under the medical hardship process. And then I think we're at the end of our slide, to be honest with you. Okay, we went over our programs quite quickly. Financial counseling is available by appointment. Just call our number. Calling that number, you just let us know where you would like to have an appointment arranged or coordinated at. We have 2 sites here for the Harrington campuses, one here in Southbridge and then over in Webster as well. If you call the number above as well, if you find that, you know what, I would prefer to go to Leominster, that number we'll be able to schedule your appointment at any of the UMass sites, whether it's Worcester campuses, Clinton, Fitchburg, Leominster, Marlborough, and or here, Webster, Southbridge.
I missed what you said about Leominster.
If you want an appointment, if you call that same number, they'll be able to schedule your appointment at any of those locations. We have financial counselors in the Leominster campus as well. Okay, so we're just showing you here the Harrington locations because we're at Harrington, of course, right? But the number does reach you to one of our financial counselors that can schedule you at any campus that we're located at, whatever is more convenient for our patients. Okay? What questions do you have for me?
A good presentation, gave a lot of good information.
Thank you.
It actually answered most of my questions.
All right, well, good. I'm glad that I was able to answer most of them. If you do know someone that does have a need, maybe you don't have a need, but you know someone who does have a need, we're more than happy to have that conversation, a phone call to a financial counselor. We can ask them a few questions over the phone and get a general idea as to what would be available or good options for the individual. Your situation may be so today, but it can change drastically in a month or 2, right? And so when you're facing new things, new changes, anytime there is a change, that's a time to always say, what can financial counseling do? What can be reevaluated to see if now I'm eligible for more coverage or some coverage where I wasn't before, okay? But our team, Monday through Friday, 9 a.m. to 4:30 p.m. is available to help anyone upon request. So please reach out to us if you need us, spread the word, and thank you. I appreciate you coming over today on this beautiful sunny day out there. It's absolutely gorgeous.